What difference has COVID made?
I work at one of the busiest stations in Metro Sydney normally. So we're always, prior to COVID, we're busy every day. Every ambulance was busy doing jobs. You add COVID onto that, and we don't have enough resources. A much higher workload. So you might have seen the ambulance commissioner said that we've had multiple days in a row that are busier than our busiest New Year's Eve, which is our busiest day of the year.
Yeah.
We're also seeing really long delay times at hospitals where we're sitting with patients for 5, 6, 7, 8 hours.
Oh, wow. Before they're admitted.
Yeah, so with positive patients, they're in our ambulance and we're sitting outside the ambulance, which is quite cold at night time. They just don't have the space for them in hospitals. We have, in the last week, so my last shift, out of all my patients, only one of them didn't have COVID.
Oh, wow.
So we're seeing the percentage of COVID patients to non-COVID patients is shifting.
And can I just ask, are you being called because their symptoms have got to a state where they suddenly realise they actually need to be hospitalised?
Yeah, generally, so it's people who've tested positive. There are some people who are just anxious about their symptoms, so they might not necessarily need to go to hospital yet.
Yeah.
There's quite a lot of people who didn't expect it to be this bad. So they're like, oh, it's just going to be like a flu. COVID is not like a flu. It's like a really bad flu plus really bad gastro combined. And then sometimes you're getting like pneumonia and things on top of that. So these people are quite unwell, and increasingly, I know in my experience, quite a lot of them are young. So I'm going to a lot of people between that 20 to 40 age bracket who are unwell, and they're not coping at home. Some of them need hospitalisation, quite a few. And yeah, there's quite a few who are really anxious about being at home because obviously we've had some deaths at home as well in young people.
What, in your view, are the things that are probably the biggest misunderstandings out there about COVID that you'd love just to have a chance just to clarify?
Where do I start?
Well, let's start with it's just a cough.
Yeah. Okay. So there's definitely a perception out there that it is just a mild flu, or it won't affect young people, or if you do get it, you'll get over it really quickly and then you'll be fine. That's not the case. We're seeing, certainly in some people, it is mild. Certainly in vaccinated people, very mild symptoms. I've only had one patient who has called an ambulance for COVID and they're positive, who had a vaccine, and they only had one, and it was within that 2 weeks that we're seeing.
Out of all the COVID patients?
Out of all of them. It's been a lot.
Wow.
So certainly it's definitely more than just a mild flu. It's not just a single system. We're seeing a lot of gastro stuff with it as well. It's certainly also got some long-term effects. So we've seen studies and reports about long COVID in young people as well. It can have significant effects on things like your lungs. You can have permanent damage there, and that's going to affect you well into the future as well.
Are lockdowns a good idea? What's your opinion?
Absolutely. Unfortunately, particularly with the Delta strain, we've seen that it's much more contagious than the original strain, the Alpha strain, I think it was. Unfortunately, the only way we can really control that is with lockdowns and preventing, obviously, the virus moves when people move. So we have to stop moving.
From your experience, what do you think might have happened if we hadn't locked down when Delta started hitting you?
We'd have a lot more cases, given that we have lockdown and we still have quite a few. But if you look at data that's been extrapolated from other countries where they haven't had lockdowns, and their case numbers are huge, so absolutely we'd have a lot more cases and we'd have a lot more deaths.
What's kind of the advice you might give, Shirley? What do you want to say to young Christians about how we can live as followers of Jesus at this really difficult, strange, challenging time?
Yeah. I think as Christians, we have an obligation to love and serve each other. And part of doing that is looking out for the health and safety of our community. And I think a huge part of that is getting the vaccination.
So you'd link that directly to love and service of others?
Absolutely. We know if you're vaccinated, you're less likely to spread it. You're less likely to catch it. You're less likely to end up in hospital, and you're much less likely to die. I think something that people are maybe forgetting about when it comes to COVID and the pandemic is that even if you don't catch it, or your family members don't catch it, beds in hospitals are still being taken up, and beds in ICUs are still being taken up. And that has a direct effect in terms of if you're getting a car crash, if you have a heart attack, if you have a stroke, ambulances are being taken up as well. So you're going to have like a longer response time in an ambulance getting to you. You know, there might be a delay in you getting a bed in hospital, in the ICU, like beds being taken up in hospitals and ambulances being taken up has an impact on the rest of society, even if they don't get COVID. We know that vaccination will reduce those things.
In any of your call outs, have you been called to someone who's having post-vaccination symptoms?
I
think that's the answer, right?
No, I don't think I have.
How can Christians be praying effectively for all the medical professionals that you're seeing around you, and of course also your colleagues in the ambulance service? What can we be praying for right now? What's needed?
Probably a big thing that I'm seeing is that a lot of my colleagues, a lot of nurses, doctors, staff who are on the front line are getting quite burnt out. Like, this has been going on for a long time now. We have a much increased workload. We're working much longer shifts. So yeah, probably prayer around upholding them, making sure we have enough resources to be able to do the job properly, being able to look out for each other. It's
a high stress moment at the moment, isn't it? Have you had any opportunities to speak of the goodness and the hope of Jesus in that area at the moment?
Yeah, I work long hours with colleagues, so they quite often ends up we have conversations that turn to faith, and there's been a few opportunities here and there to be able to express where my hope is.